12 Ways to Relieve Sciatica Fast in 8 Minutes. Sciatica is one of the most common reasons for pain in your lower back, legs, bottom, and feet. Relief. Caused by compression of the sciatic nerve, it can make these areas feel numb, tingly, or painful. What is sciatica and why is it painful? Sciatica is an uncomfortable condition that causes pain in the lower half of your body, from your lumbar spine down to your toes. It usually affects just one side. The sciatic nerve is the longest nerve in the human body. It runs from your lower back down to your feet. When the sciatic nerve is compressed, for example, by a herniated disc or a narrow spinal canal, it can cause pain that ranges from a mild ache to severe shooting sensations from your buttock down one leg. Sciatic pain can even cause referred pain in the groin area. Common symptoms of sciatica include numbness in the affected area. Your legs might fall asleep more quickly than usual. Tingling or pins and needles from the lower back to the foot. Shooting pains that radiate down your leg. A dull ache anywhere along the sciatic region. Lower back pain accompanied by discomfort in the bottom, leg, hip, or feet. Lower back pain on its own is rarely a sign of sciatica. Alleviating pressure on the sciatic nerve is the best way to treat sciatica. I will tell you the effective 12 ways to relieve sciatica fast in 8 minutes. 1. Rest for a short time. Sciatica can flare up if you've been moving a lot, walking quickly, or walking long distances. In some cases, sciatica can become so painful it's hard to walk. 2. Cat-cow pose. Start on all fours, with your knees positioned below your hips and your hands beneath your shoulders. With a gentle bend in the elbows, round your back while looking down towards the floor. Hold this position for a couple of seconds. Then, smoothly and slowly, push your belly button towards the floor and arch your back downwards while looking up towards the ceiling. 3. Bridge technique. Lie on your back with your knees bent and hip width apart. Place your hands on your stomach and keep your spine neutral. Using your stomach muscles for stability, slowly lift your pelvis off the floor until your body forms a diagonal line from your head to your knees. Hold for a few seconds, then lower your pelvis to the ground in a controlled motion. 4. Quadruped arm and leg lift. Start on all fours, with your knees positioned below your hips and your hands beneath your shoulders. Slowly stretch your left leg out behind you to its full extension and rest your toes on the floor, keeping your hips level. Reach your right arm out in front of you while gently raising your outstretched leg off the floor. Try to keep your spine level, with no arching or rounding. 5. Piriformis stretch. If your sciatica is caused by piriformis syndrome, a condition in which the piriformis muscle below your glute spasms and causes discomfort, a piriformis stretch may alleviate this. Sit on the edge of a chair and put the foot of your affected leg on the opposite knee. Tuck your tailbone in to keep your back straight as you lean forward from the hips as far as comfortable. You should feel a stretch in your hip and lumbar region. Maintain this for up to 30 seconds, then return to the starting position and swap sides. Repeat up to 5 times on each side. 6. Low impact exercise. Staying active can help improve your sciatica symptoms quickly by loosening up your sciatic nerve, providing you don't have an activity-induced flare-up. 7. Apply an ice pack. Ice packs on the lower back, or even a bag of frozen peas, can reduce inflammation and sensation around your sciatic region. Hold an ice pack to the painful area at sciatic nerve for several minutes until you start to feel relief. 8. Go swimming. It's hard to fit in a full swimming session in just 8 minutes, but the good news is that just being in the water can relieve some of the pressure on your nervous system. So even a short dip may help alleviate some of your sciatica symptoms. 9. Acupuncture. Acupuncture works by stimulating nerve fibers that inhibit pain signals, while also triggering endorphin release. Endorphins are the body's natural painkillers, and may help ease your sciatica symptoms quickly and effectively. 10. Have a massage. Massaging the tissue in your glutes, thighs, calves, and lower back may provide quick relief from sciatica. If possible, book a sports massage or a deep tissue massage with a professional massage therapist. 11. Painkillers. There's limited evidence that over-the-counter painkillers like paracetamol and ibuprofen provide fast sciatica relief. But your pharmacist, GP, or sciatica specialist may be able to recommend or prescribe a different painkiller that will relieve your symptoms quickly. 12. Steroid injections. Steroid injections can offer instant relief for sciatica and is something a hospital will do for sciatic pain. They're usually administered alongside a local anesthetic that numbs the area, providing immediate sciatica pain relief while the steroids take effect. What's the best way to treat sciatica pain? The best way to treat sciatica pain is to unearth and address the root cause. This takes longer than 8 minutes, of course, but it's more likely to give you long-lasting results than the quick fixes out there. Thank you for watching. Don't forget to follow us and subscribe to our channel, and if you have questions about this condition, write your question in comments below the video and we will answer it. Thank you for watching.